You're about to have heart surgery. At Tallahassee Memorial Healthcare, we want you to be as comfortable with your upcoming procedure as possible. So we put together this video to give you some idea of what you can expect over the next few days. Please feel free to make notes, and if you have any concerns or questions, make sure to discuss them with your nurse or doctor. 2 nights before surgery, you'll take a shower using an extra strong antibacterial soap, concentrating on your chest, back, arms, and legs. The entire process will be repeated the night before surgery. The day before surgery, we are going to run some tests which will include taking blood and urine samples, an EKG, and a chest x-ray. We will also check for common strains of bacteria, so we'll know which antibiotics you might need during surgery. Your nurse will share the results when they are complete. In addition, you'll sign your consent for surgery form, including your consent for a blood transfusion if needed. You are certainly welcome to object to a blood transfusion, but keep in mind, your doctor wouldn't order it unless he really felt you needed it. The night before surgery, you'll take another shower, and afterwards, we will scrub your entire body with antiseptic wipes. You'll receive a few additional medications in a suppository to help clear your lower GI tract. We'll swab your nose with an antibacterial ointment to help prevent you from breathing in anything that might infect you. We'll have you swish some special mouthwash to help prevent any bacteria from getting to your lungs. The day of your surgery will begin extremely early with your nurses and techs clipping most of your body hair. You'll be able to rinse off in the shower, but will not be allowed to get your head wet or use soap. Again, the nurse will follow up with antibacterial wipes all over your body. The day before surgery, you'll be informed of your surgery time and when your family should come to visit before your operation. The surgery will take a few hours. You'll have a tube down your throat, so a machine can handle your breathing for you, and a Foley catheter will be inserted to help empty your bladder. You'll have one main incision down the center of your chest. If you're receiving a valve, this will be your only surgery. If you're receiving bypasses, veins will need to be harvested from one or both of your legs, so you'll also have leg incisions. Toward the end of the surgery, the doctor will place chest tubes in the area around your lungs. These will help drain away any excess fluid produced by your body following surgery. You might come out of surgery to find yourself with mittens on your hands. This important precaution keeps you from pulling at any of your new lines until the anesthesia has worn off, and you're awake enough to realize you're not supposed to do that. You'll be admitted to the ICU, or intensive care unit, for at least one night, if not more. If you spend more than one night in the ICU, it's only because everyone heals at a different pace, and sometimes there simply isn't a room available for you on the cardiac progressive care unit. Your family is not allowed to spend the night with you in the ICU, but there are waiting rooms nearby. Keep in mind, you'll have a lot of medical equipment, and as you move through this recovery process, you'll need less and less of it. Let's talk a bit about pain management. Although you'll not be able to speak because of the tube down your throat, your nurses have been trained to watch for signs that you are hurting and will be able to relieve your pain with IV medications. Once your breathing tube is removed, we can also give you oral medication to help manage your pain. When lying in bed or sitting in a recliner chair, you might feel like you're not having much pain, but that's only because you're not doing anything. Trying to get up or walk to the restroom will most likely cause you some pain. Our goal is to help you stay in front of the pain, and that means medicating you for what we expect will produce pain, such as walking. You're the focus of all of this, so if you have questions or concerns about your pain management, feel free to discuss it with your nurse and doctor so we can work on it together. The day after surgery is when your real work begins. One of our primary goals is getting you up and moving again. It sounds simple, but it will be challenging. Eventually, we want you walking the hallways on the cardiac progressive care unit 5 to 6 times a day. But on day 1, we start with a goal of 2 times. We want you to get moving because this helps drain any excess chest fluid into the tubes we mentioned earlier. Not only does it help with drainage, but also with breathing. Your entire chest cavity will be sore, and you might not notice it, but your breathing will be much more shallow than normal. Every time you walk in the hallway, you will place a heart sticker on your door. This helps everyone know how you're doing and shows the doctor how mobile you're becoming. You'll be asked to use your incentive spirometer for at least 10 deep breaths for each hour you're awake. This helps move air to the base of your lungs so you don't develop pneumonia. It's quite common to not have a bowel movement for a few days after surgery. Remember, things aren't moving around inside as fast as they normally do. This is where walking really helps, and your nurses also have medications that can help if needed. We will do our best to accommodate your food preferences, but don't be surprised if you have a poor appetite until the anesthesia has completely left your system. It's also quite common after surgery to gain fluid weight. So when our patients aren't up and walking in the halls, we want them sitting with their legs up. Keeping your legs elevated when not eating or walking is the best thing you can do for yourself, because this helps move any fluid back up to your heart and kidneys where they can be excreted more easily. You might also receive a diuretic or water pill, which will make you urinate away a lot of excess fluid. The amount of urine you produce will be noted on your chart as a measure of your progress. You will have a special dressing on your incisions that will stay for 7 days or until you are discharged from the hospital. Your heart's been through a lot, so it's not uncommon after surgery to have occasional irregular heartbeats called arrhythmias. You'll be on a monitor at all times, and should you have an arrhythmia, the nurses will alert your doctor and usually put you on a medication drip to help return the normal rhythm. Once your heart returns to a normal rhythm, you may need to stay on oral medications for a few months. Once your chest tubes are removed, you'll have to wait an additional 24 to 48 hours before being allowed to shower. Of course, this means you've not been allowed to shower for several days. So by all means, when the nurses offer a sponge bath, take them up on the offer. Also, when you get home, don't apply any creams or salves directly onto your incisions. You might think this will help, but it actually puts you at a higher risk for infection. They will heal nicely on their own, so please, no baby powders, antibiotic creams, vitamin E creams, Neosporin, or things of that nature. Once you transfer out of the ICU, back to the cardiac progressive care unit, you'll be in a private room. So if a family member wants to stay with you overnight, let us know, and we'll order them a cot. Every patient will be on oxygen immediately following surgery. The nurses will work with the respiratory therapist to wean you off the oxygen. On rare occasions, patients might be discharged with the oxygen for a few weeks after surgery. It's also not uncommon for patients to need additional help before going home or needing home health care when they get home. This just helps you get back to your old self as quickly as possible. You won't be allowed to drive or go for long car trips for approximately 6 weeks after surgery. Quite simply, your chest bone is broken, and although you might be the best driver in the world, we're worried about the other drivers who might not be. You can go for short car trips to your doctor's appointments and other necessary errands, but whenever possible, we really want you to avoid riding in or driving a car. Your doctors will discuss this with you at your follow-up appointment and let you know when they feel it's okay for you to get behind the wheel again. We're hopeful this gives you a good idea of what to expect during the next few days. This really is all about you, so feel free to ask any questions you might have. Every case is different, but we want your care to be tailored to your needs as closely as possible. At TMH, delivering the finest care possible and getting you back into the swing of things as quickly as possible is our goal every hour of every day.